Hi, welcome to Myrtle's Detox and Wellness Spa, or Diabetes Series, lesson number 6. Diabetic complications, preventions, and identifications. So what are some of the complications that you have with diabetes? There are micro complications with small veins, like in the eye and the kidneys and the feet and the skin. Or there could be larger arteries, like in the aorta, that affects the heart or even the brain. All right, so we want to be able to identify what these are and thus prevent complications from coming up. So, for example, we know that damage to the eye may cause blindness. So what can we do in order to prevent that? Well, you need to check your blood sugar on a regular basis. Make sure that the blood sugar is not getting too high, because if the sugar is too high, that would prevent the blood from going through those tiny blood vessels in the eye. Okay, so complications for your eyes would be blindness if it's not treated, if the blood sugar is high. Then we have the kidneys. The same small blood vessels in the kidneys. If the blood cannot get through those small vessels, it's going to damage the kidneys, and someone will end up on dialysis. Then we have complications of the feet. You see a lot of people with their feet turning black, and sometimes amputation to the body part as well. If you look on this foot that I have up here, it shows you that the black areas indicate the pressure points that needs to be checked. Check for sensitivity. Now, this is called a monofilament. Hope you can see it. It's a very tiny tool. And healthcare workers would check to see if you have feeling in those areas of your feet. But you can do that for yourself at home, right? Just check it periodically. Because if you're not feeling at these points in your feet, that means you're losing sensation. And loss of sensation eventually leads to death of the feet, amputation. You don't want that. That's a severe complication of diabetes. Right. Now, also, in reference to taking care of your feet, when you bathe, your feet should be totally dried in between the toes, dry in between the toes. But if you're going to cream your feet, do not cream in between the toes. You want the in between the toes to stay dry. When you're clipping your toe nails, make sure that the clipper is straight, not the rounded edge. You do not want to cut your nails all the way to the cuticles, because as you know, with diabetics, cuts are very hard to heal, and you do not want to damage your skin in any way. All right, so keep your feet dry, cut your nails. Do not file down those bunions to the point where they're going to bleed. You need to go to the doctor to have your feet checked on a regular basis. Now, if you have vision problems, taking care of the feet is going to be hard, because you're not going to be able to see what's going on with your feet. So get someone to help you taking care of that. All right. Now, the stomach, complications of the stomach with diabetes is that you feel full. The food is taking longer than usual to digest and get out of your system. So you want to keep your blood sugar in check, because when it's out of whack, that's what happens. Those are some of the things that happen. So with the eyes, is retinopathy, which means damage to the retina, to the back of the eye, and become blind. With the kidneys, it's nephropathy, which can lead to someone having to take dialysis because of kidney damage. And then with the skin, neuropathy, the nerves. You can't feel, you don't have any sensation. You do not know when you step on a nail or a glass or a piece of stick that punctured your skin, and then now you end up with a cut and you're not able to feel, and you can actually lose your limb because of that. So now, your doctors that you should be following up with is a dietitian to take care of your diet, a podiatrist to take care of your feet, a cardiologist for your heart, nephrologist for your kidneys, endocrinologist is the one that's going to deal with your diabetes overall, and hopefully you don't have any mental issues, because then you'll need a psychologist. And then a gastroenterologist for the stomach. Now we go on to your teeth. Your teeth also should be taken care of on a daily basis by brushing and definitely flossing. And every 6 months or so, you need to go to the dentist for a deep cleaning. This is vitally important if you're a diabetic. Get rid of the plaque and the buildup from between your teeth, because that can cause even further complications. Cause you to lose your teeth and just compound the problem. All right? So you want to be able to do your flossing daily, your brushing daily, and your deep cleaning at least twice a year. So those are the things that are going to prevent you from losing your teeth, which now are going to prevent you from digesting your food properly, because now that's an additional problem. So there we have that. Now you want to be able to pick up any problem early. For example, if you're having dizziness or loss of vision or blurriness or a halo around your eye or black spots, go and check your eye doctor. You may even want to check the cardiologist, because these are some of the symptoms also if you're having a heart problem. And that also includes difficulty breathing, irregular heart rate, and swollen ankles. Sometimes people think that it's just a swollen ankle, no big deal, I just put my feet up. But it could be heart problems, it could be kidney problems, it could be diabetic problems. So get them checked out. You say, check your dentist regularly, check your heart doctor regularly, and definitely check your ophthalmologist as well. Be careful of your feet. When you're sitting, put your feet up, okay? Check your shoes. Make sure that your shoes do not have any sharp objects in there before you put them in. Because if your sensation is decreased, then you can actually damage your feet as you walk. So there you have it. Look out for identifiers. Look out for areas that are not normal, so you can have them checked out and reverse the different issues that you're having, so you do not further have complications that's going to be detrimental, like losing your vision, losing your limb, losing your kidneys. So there you have it for lesson number 6, complications, identification, and prevention. Remember to like, share, subscribe, and if you haven't done so before, put on that notification bell so that you can get the further lessons as they come up. Bye.